Welcome to Dateline Health. This is Fred Lippman coming to you from the Allen B. Luran Center here at Nova Southeastern University. It's the Innovation Center, and it's a combined effort between Nova Southeastern University and Broward County Board of County Commissioners. Today we have a very interesting guest because we've had, as I always tell you, this program, which we've been going on for 26 years, and we always try to answer questions that come to us from our viewers. And there's a lot of conversation that comes to us about rheumatology. Well, you know, I got rheumatic fever, I got rheumatic this, I got a knee, I got neck, I got all kinds of things. You know, where do we go? Well, we go to the Holy Cross Medical Group, and sitting here and about to talk to Dr. Santiago-Casas, and she's a rheumatologist. So welcome.
Thank you so much for the invitation. My pleasure.
So tell us about, before we get into your field, tell us about the group and how you, what you provide for the public.
Absolutely. So the Holy Cross Medical Group is a multi-specialty group providing a whole array of services for our population of patients. We know with the convenience of having all the specialists throughout our centers and expanded throughout our area. And in my particular field of rheumatology, we have two additional rheumatologists in our group, and we're just right across from the hospital in the outpatient building. So you have the importance here of, especially when we're dealing with complex conditions, of having other specialists that are accessible to co-manage these complex diseases.
Well, let's get started by asking you a question, and that is, what are the most common types of rheumatic conditions that you treat?
So it's a little bit complex because rheumatology, we not only treat arthritis, we treat also autoimmune disorders. So most commonly you see osteoarthritis, or what people call wear and tear arthritis, right? So we definitely see those patients, but aside from that, we treat the inflammatory part of the arthritis and autoimmune conditions. So that's more complex, and it has multiple different types of arthritis that we see here, including rheumatoid arthritis, psoriatic arthritis, arthritis associated with lupus, also gout. And we have, other types of arthritis and other types of autoimmune disorders, including vasculitis, including also osteoporosis. And, so it's, like I said, we deal with not only joints, but also non-joint related conditions that can eventually affect the joint, but start in other organs or present in an atypical way. So the rheumatologist sees multiple conditions, like I said, both joint related and organs that are affected as a consequence of those conditions.
You know, we've been doing, like I said, we've been doing this show for 26 years, and the questions come from the viewers. And I always remand my feelings to them, to tell them that if something is bothering you, something is aching you, something you have some problems with everything, breathing, movement, whatever, you got to see your doctors. I mean, you can't guess. You can't go walking into a pharmacy or a supermarket and pick something off the shelf, particularly in the area where people are aching, you know. Oh, I'll just pop a couple of this and there, and I'm okay. I can walk good with a cane, or, whatever. It must be really difficult for many people to make a decision to go to a doctor who then somehow gets them to someone like yourself. Do you find that?
Absolutely, because they feel I did something wrong. I was exercising in a certain way, or I slept wrong, or it's my mattress. It's so many different things that they can attribute the pain to in a particular situation when it might really be a manifestation of an ongoing issue that they have. So if you feel any sort of joint pain, and it's something that it's affecting your lifestyle, that you see that you wake up in the morning and you feel achy, you feel tired, fatigue, you feel stiff, your joints are just stiff. And of course, you can see even swelling and your rings are not fitting properly, or you're limping because your knee it's bigger, warm. Those are things that prompt you to seek evaluation, of course, with your primary care physician first, and then, but if there is a problem that persists, you need to see the specialist, and in this case, like I say, a rheumatologist, when we're dealing with joint related problems, and especially symptoms like this that are so vague: fatigue, tiredness. Where is it coming from? Am I not sleeping properly? Is it because I have some deficiency? Is it my blood work that is low? So many different things can impact it, but at the same time, it can be an early presentation of what you're going through. So that's a signal. Or if I'm losing weight, I'm losing my hair, I have mouth sores. Those are all things that are indicators of a process that is ongoing, and you might miss it because it's attributed to something else. So in tying up that puzzle, that's where the rheumatologist comes into play, because if it is a persistent issue, it's affecting your lifestyle, it's not going away, it's not just going to the pharmacy and getting a remedy, it's trying to find out what is the root of the problem, putting all the pieces together, and get help so you feel better.
In our discussion before we began the show, I believe you are a group of internal medicine folks who do basically, not basically, that's your focus, is the issue of rheumatoid diseases, particularly, you just mentioned rheumatoid immunology condition. So why don't we get to that and let the people know it's not the seriousness of it, but the capability to help those folks out there that are really suffering.
Absolutely. You have to look into seeing the specialist, and it's important because certain conditions, especially when we're dealing with, like I said, inflammatory conditions, to give you an example, rheumatoid arthritis or psoriatic arthritis, you have a time frame of treating these conditions early, so you catch up the disease in an early stage where you prevent progression of it and damage in the future. So you have to attack it early so you don't get this structural, this damage to your joints that then may become irreversible. So that is so important that these symptoms are addressed early enough so that we catch them early enough, because the studies have shown that as you catch these conditions early during the process, you are going to have a better outcome in the future. So if somebody is treated within the 6 months of them having symptoms, is very different than somebody that comes to the office after a year or 2 years of having the symptoms and just delaying the process of seeking help, feeling this way, trying to, take this anti-inflammatory, feel a little better, keep going, and then it comes back, and then they continue doing so. And in a year, there's already damage that has occurred. And you can't revert that, in some of these diseases. So that's why it's so important. Going to the internet, yes. Google us, in this case, it's Holy Cross Medical Group. And you go to a rheumatologist and you seek help for your symptoms because you need to identify and treat them early in the process.
You mentioned a group of different arthritic conditions. Do you test at your venue? For example, you mentioned psoriatic arthritis. I just so happens that somebody asked a question of us about how do I get care for psoriatic arthritis. I just moved here from California and I'm looking for a place. But, there are different, I guess, shall I say, elements of indications that have to be presented to you. Well, not presented to you. They are now your patient. But how do you do that? Do you test? Do you observe through various entities? Give me some idea as to how you do it.
Absolutely. So when you see the patient, you obviously do your thorough history and examination, because the history provides a lot of the information that you need to tie up those symptoms and come up with a diagnosis, along with the tools, which is that precisely doing your blood work, laboratory tests that we need to assess for the different types of presentations of arthritis that can be causing those symptoms. And yes, blood work can show that. So the blood work is very useful. It shows if there is inflammation in the blood. There is antibodies or tests that are done to check if you have that predisposition. If that is noted in your blood, there is a blood draw that can show it. But again, it's a little bit more complicated than that, in the sense that some patients can have those antibodies negative. So those tests that are typically found that help us identify or confirm a diagnosis might be negative. We call that seronegative, but that doesn't rule out that you have the condition, because like I said, there's a group of patients that can have negative blood testing. So that's why you have to do your assessment clinically by what the patient is presenting, what you find in your exam, with the characteristics that go for the different types of arthritis. And then, yes, the blood work helps you, and images help you as well. So if these are, conditions that have been going for a while, X-rays, images can help you identify the changes that you need to see to differentiate between the different types of arthritis. And if you need more sensitive imaging, like for example, MRI or magnetic resonance or an ultrasound, you can also do that. And those are tools that allow you to detect earlier changes that might be missed because of how early you caught this condition, for example. But it's the clinical, is what you see in the patient, your examination of the patient, and of course, tying it to your blood work, what really helps you to identify what type of arthritis you're dealing with. But again, our conditions are ongoing. So you need, of course, to monitor the patient through time to assess that this patient is responding to your treatment, that it's in accordance with what you determine that the patient has, that they're responding to your treatment plan, and that they are actually, improving and their functionality is there, because that is your goal at the end of the day. Your patient must be, working properly, functioning well at home. Their functionality is preserved, their pain is controlled. So that's our goal. It's that remission or that status of the disease where they're controlled is not experiencing pain, not detecting inflammation, blood work and imaging, and the patient being functionally active and having that quality of life, which is our goal for our treatment.
With reference to that, in short term, I'm sure there's a multiplicity of management elements to the different types of rheumatoid or arthritis issues. But in general, is it not only taking of pharmaceuticals, but is also presenting certain care relative to, shall I say, physical therapy and things of that nature? Do you want to talk about that?
Absolutely, because that's precisely what needs to be done. It's addressing the problem, diagnosing it, and determining what the patient needs. But this is with a multi-specialty approach. Patients need, in many instances, to see our orthopedics because they have specific damage. Like I said, we have had these conditions for a certain amount of time. There is cartilage loss, there is advanced progression of the disease, and they need to see the orthopedic surgeon for a management of different needs that they have. Exercises are very important as well. So physical therapy plays a huge role in certain, stages of their disease, need to go to a physical therapy center because they need that assistance. First of all, you learn how to do the exercises properly. It helps manage the symptoms with different modalities that are used in physical therapy, and that's well proven. And then they follow up with that program at home, and they continue those exercises and those instructions at home, and that's part of the management of the patient as well. And obviously also the patient needs to sleep properly, so you always address how is their sleep pattern, their mood. Of course, it's something that we keep an eye on. How are they, managing this disease? Is there a sign of depression? Is there anxiety? So you have to always question about that in your visits to make sure the patient is, basically part of the treatment is the patient engages in making sure they're participating in controlling their disease as well, that their mood is up, that they know what resources are there for them. So I do use a lot of the resources in the internet. Patients can go into different websites and look into their condition, what resources I have through our American College of Rheumatology, of course, but there's other resources that they can go into, and there's tools that help them manage those symptoms. And we also refer to therapists when we identify problems that they need more specific, therapy to help with this, because it's hard. You're dealing with pain, fatigue. It's difficult, and of course it's a natural response of the human being to feel down, because you're worn down from all of it. But you must address those symptoms as well. It's part of your treatment, and you will feel better if that is also addressed.
You speak of research. Are any you or any of your colleagues involved in any research elements at your practice?
In this current moment, there is no active clinical trial running, but we have the availability to refer the patient for clinical research in different areas that we have access to. But that's also something in the horizon. And it's definitely part of what we do in rheumatology, because it's an evolving field. It has evolved through the years, and research is crucial because it identifies new targeted therapies that are continuing to progress and evolve through the years and have been life-changing for our patients. You see a difference of how managements were in the past, and unfortunately, all the hurdles and all the different things patients had to endure because there wasn't that targeted therapy. But as we have progressed through research, we have identified targeted therapies for our patients that are life-changing. And it's definitely a tool that we definitely always rely on. And some patients do not respond to specific treatments that we are giving them, and we have to switch medications, but we have the tools to do that. There's many different approaches nowadays for our different types of arthritis. And speaking specifically about inflammatory arthritis, like I said, array psoriatic arthritis, we can say ankylosing spondylitis, and I can go on and on. But there's different medications targeting, guided towards a specific molecules that have been shown to cause the inflammation and to lead to the damage in these conditions. And we can transition, we can change one medication to the other and tailor it to our patient. So that's amazing in our field, and I'm very happy about our success throughout the years.
You brought to my mind a question that came from one of our viewers, and they were talking about biologics. Are they effective? I mean, I'm not asking you to put your imprimatur on it, but I mean, that was the question that was asked by a viewer.
Absolutely, yes, they're very effective. So when we have a patient with a moderate to severe form of our arthritis, we have different ways to approach the treatment, but biologics are crucial, and they're there to help our patients. As I said, establishing them in an early way when we are dealing with specific characteristics of patients. When we see our patients and they meet this criteria, and that has been determined by our guidelines, they meet the criteria for the patient to be treated with a biologic, and the biologic is initiated in a certain stage and early on. You see the changes, and you see not only managing the current symptom of pain and inflammation, but also preventing progression or damage of the disease, and keeping the patient functional. So huge impact on those patients' lives. and preventing progression of their disease. It's definitely a tool that we use, and we do this every day. And like I said, there's criteria of how we meet of the patient, how they meet certain criteria to enter a specific medication versus other. It's not like a recipe, you don't see somebody and they're like, oh, right, straight away, I'm going to give you this. No. So you have to take the whole picture, see what the patient is presenting with, what type of arthritis you're dealing with, and then take into consideration what other diseases they have, what are their comorbidities that prevent you from using this versus the other, because this one is more suitable for your patient. So, but we, like I said, we have these tools these days because there's so many different medications that have been proven to be effective, life-changing, and that are going to make a difference for that patient. If this one doesn't work, we can always switch medication after a certain amount of time of assessing, because we know how long we need to wait for that medication to take into effect if that effect is not there. And we use tools both clinical and by labs, and also function testing. So if that is not noted, then we can transition to a different medication.
As part of the elements of your center is to give people opportunity to realize that they can live an effective and pleasant life rather than being someone who's attached to a couch chair and watching television, correct?
Absolutely. So that is why that's our goal. Like you said, precisely, it's keeping these patients functional, having your lifestyle, able to walk your dog, do your activities that you like to do, enjoy. And no, do not do that. Don't be in the couch watching TV, because that's precisely what we want to prevent. And in our center in Holy Cross, we have the option of, in many instances, engage in those different exercises through our different centers, multiple areas to do therapy, and there's programs just for exercise as well. So you are always motivated to keep yourself engaged and active. And at the same time, in this population, when you have all those different diseases attacking your heart, your lungs, etc., we have all the different specialists to evaluate you, to assess you. And especially in our field, it is crucial that there is an access to those specialists, because you have to consult with them, you have to co-manage these patients. These are not isolated. It's, for example, a patient with lupus is not, they're not just fatigued and their joints are hurting. In certain spectrums of the disease, your kidneys might be affected, you might have very bad anemia, your blood levels. So that requires you to have that blood specialist, hematologist there, to have your kidney specialist accessible, so you can manage the patient and we work together in the best interest of the patient. And that's very important because it affects so many areas, being that our diseases are multi-systemic. So yes, it's something that folks around here always need to keep in mind, that you have those tools, that you have that access. You just need to go and get it, get your attention, get your service, and be seen and get your treatment.
I appreciate what the Holy Cross Medical Group is doing, and I'm very, very happy that we have you now as part of the group as a rheumatologist, because we're down to the last couple of minutes of the show, and if I didn't tell you that we're happy, and they are going to be happy to know that we have such a thing available, then we wouldn't have any need for answering these questions. So I'm going to give you one more minute, and you say whatever you want to say.
Thank you so much. My pleasure. I'm just happy to be here, to be a part of Holy Cross Medical Group, and I enjoy my specialty very, very much. I love being a rheumatologist. I enjoy what I do. To me, it's always a challenge, because I like challenges. So when I'm presented with cases that are complex, it's very engaging to me, making sure how I can make this patient feel better. Sometimes I have patients that have been, dealing with these conditions for so long, a little bit lost, they don't know what to do, and we just have to incorporate, like I said, all these symptoms. It's a little bit of that investigation, talking to the patient, listening to the patient, obtaining an adequate history, doing a thorough exam, and using the tools to help you come to that diagnosis and treat these patients. And you will see the difference. And that's how much I enjoy what I do, because you see the difference in the lives of the patients. The patients is a night and day how they feel, how they're able to function. And that, that's your job. That's at the end of the day how happy I am to be a rheumatologist, because you see what you're doing to change the lives of those patients. But I can't emphasize enough the importance of not minimizing your symptoms, thinking, oh, this is normal wear and tear, my aging process, I might just be tired, I'm just going to deal with it. No, you have to always seek attention. Your body talks to you. Do not ignore your symptoms. Any joint pain, stiffness, tiredness, fatigue, hair loss, mouth sores, rashes, seek the attention from your physician, as these may be manifestations of an ongoing process that has not been identified. And that is the importance of seeing a rheumatologist.
You hit. I usually say at the end of the show, I always remand my wish and my determination to our viewers to tell them, please, you have to talk to your doctors. You know, don't just walk in, as I said before, just don't walk into a venue like a supermarket or a pharmacy and pick something off the shelf and think that you're going to get some relief. Yeah, you might get some relief, but the information is the most imperative, important thing that is necessary to your physician. And you let your physician guide you to it in a direction. And I want to thank you very much, Dr. Santiago-Casas, for being here today and really expanding my thoughts of many years. And you put it right out on a table as to what I've been begging people to do for a long period of time. So thank you very, very much. We appreciate the fact that you have the Holy Cross Medical Group.
Thank you so much for the invitation. My pleasure.
Folks, as I say, you've heard it. It's been repeated. I've said it for 26 years. You have to see your doctor. Don't try to take care of it by just saying that I'll deal with it somehow by picking something up in, like I said, in a pharmacy or. Nothing wrong. I love pharmacies. It was my first profession. But the bottom line is that you need to be able to see your doctors. This show is called Dateline Health. If you have any questions or you want any contact with us, there's an email address and a telephone number right here. And remember, my name is Fred Lippman, and I come to you from Nova Southeastern University. Until next time, see you.